Hello and welcome back to another video of Netter's Anatomy Coloring Book. Thank you for joining me again. I hope you are cozy and comfortable. Take a deep breath and let it out. Today, we're going to be covering the posterior muscles of the shoulder. So I'm just going to pick a few colors here to get started. Posterior shoulder muscles are all the muscles that have attachment to the scapula. We're including Latissimus dorsi with this, as it may have a partial attachment to the inferior angle of the scapula. Let's start with our first muscle, the trapezius. Now, the proximal attachment of the trapezius is the medial third of the superior nuchal line, the external occipital protuberance, ligamentum nuchae, and the spinous processes of C7 to T12. The distal attachment is the lateral third of the clavicle, which we can't really see here from this angle. But here we have the clavicle here. So it's the lateral third of the clavicle. The acromion, which we can see here, and of course the spine of the scapula. So the trapezius muscle is innervated by the accessory nerve, and its main actions are to elevate, retract, and rotate the scapula. The superior fibers elevate, the middle fibers retract, and the inferior fibers depress the scapula. Okay, so the next muscle is the Latissimus dorsi. The proximal attachment is the spinous processes of T7 to T12, the thoracolumbar fascia, the iliac crest, and the inferior three ribs. The distal attachment is the intertubercular groove of the humerus, which again we can't see all that well as it's on the anterior side of the shoulder, but you can see how the fibers lead up underneath the arm, and then they attach at the front of the humerus. And as you can see, we have the Latissimus dorsi on both sides in this specific diagram. Okay, so Latissimus dorsi is innervated by the thoracodorsal nerve, and its main actions are to extend, adduct, and medially rotate the humerus at the shoulder joint. Okay. So our next muscle is going to be levator scapula. The proximal attachment of levator scapula are the transverse processes of C1 to C4, And the distal attachment is the superior part of the medial border of the scapula. So you can see that here. Okay. Our next muscle, or I should say muscles, are going to be rhomboid minor and major. So the proximal attachment of rhomboid minor is the ligamentum nuchae and the spinous processes of C7 and T1. And the proximal attachment of rhomboid major is the spinous processes of T2 to T5. The distal attachment is the medial border of the scapula from the level of the spine to the inferior angle for both muscles. So, rhomboid minor and major are innervated by the dorsal scapular nerve. And the main actions of these muscles are to retract the scapula and rotate it to depress the glenoid cavity of the shoulder. And it also fixes the scapula to the thoracic wall. Our next muscle is the supraspinatus muscle, which is part of the rotator cuff, or also known as the sits muscles. So the proximal attachment to the supraspinatus is the supraspinous fossa of the scapula and deep fascia. So the fossa that lies underneath this muscle. The distal attachment is the superior facet on the greater tubercle of the humerus. I just love how colorful this is starting to look. Okay, so the supraspinatus is innervated by the suprascapular nerve, and its main actions are to initiate arm abduction. I believe it's the first 15 degrees of arm abduction, and acts with the rotator cuff muscles. Okay, the next muscle we'll be coloring in is the infraspinatus muscle, which is also part of the rotator cuff. The proximal attachment is the infraspinous fossa of the scapula and deep fascia, and the distal attachment is the greater tubercle of the humerus. There we are. Okay, so the infraspinatus muscle is also innervated by the suprascapular nerve, and the main actions are to laterally rotate arm at the shoulder, and it helps hold the head in the glenoid cavity. So it just pulls on it there. So So the next muscle we're going to color in is teres minor. It is also part of the rotator cuff. The proximal attachment is the lateral border of the scapula. And the distal attachment is the greater tubercle of the humerus. Okay. So, teres minor is innervated by the axillary nerve, and its main action is to laterally rotate the arm at the shoulder, and it also helps hold the head in the glenoid cavity. So the next one is teres major, which is not part of the rotator cuff, right here. Its proximal attachment is the posterior surface of the inferior angle of the scapula, and its distal attachment is the medial lip of the intertubercular groove of the humerus. So again, we can't see that groove. It sits at the anterior aspect of the humerus, but as you can see, the muscle fibers follow underneath the arm and come forward to attach into the front of the humerus. Okay, now we have one more muscle that we're going to cover. Let me just get my color here. Now this one is the Subscapularis. We are not going to see it here on this diagram, so I'm just going to come down here, because this muscle sits underneath the scapula. It is part of the rotator cuff. Its proximal attachment is the subscapular fossa of the scapula, and the distal attachment is the lesser tubercle of the humerus. So there we have it, the subscapularis on the anterior surface of the scapula. It's innervated by the upper and lower subscapular nerves, and its main actions are to medially rotate the arm at the shoulder and adduct it. It also helps hold the humeral head in the glenoid cavity. While we're looking at this aspect of the shoulder, I'm going to color in Subscapularis, which you can see here. So this is looking downward. This is a superior view. There's the spine of the scapula there. And as you can see, the belly of the muscle runs underneath the acromion. And then I think we can see some infraspinatus fibers there. So I'm going to go ahead and color that in purple. And then we have the teres minor tendon there, which we'll just give a little red to. There we go. So if we look at this aspect here, this appears to be the anterior aspect of the scapula. So this would be where subscapularis sits. And we know this because we can see the coracoid process and the acromion. So we'll color that in. Okay, so that is subscapularis, and if we look over here at the posterior, posterior view, then we have Teres minor, Infraspinatus, and Supraspinatus. So we'll start with Supraspinatus. Purple for Infraspinatus. I'm trying very hard not to block your view here, but it's an awkward muscle fiber direction to color in, especially when I'm left-handed. Okay, last one, Teres minor. Now, what did we color it in? It was a teal. Oops. Oh, and I've just noticed that I missed the Supraspinatus. So, get our dark orange. There we go. Now, we're going to put it all together with this oblique parasagittal section of the axilla. So, number one, that is our trapezius. So this muscle here sits there. Number 3 is our supraspinatus, which is our dark orange. So our supraspinatus is this muscle right here and this muscle right here. Number 4 is our infraspinatus, our purple muscle. So infraspinatus and infraspinatus. There we go. Number 7 is our subscapularis, which is brown. So that is the muscle that sits anterior to the scapula. Our number 5 is Teres minor, which is red. So our Teres minor is there. Oh, I just realized I colored Teres minor in wrong over here. I used the Teres major color. That's my mistake. Okay, number 6 is Teres major, which we used the teal for. There we go. So that's our Teres major there. Not there, but there. Sorry for the confusion. Okay, and lastly, we have Latissimus dorsi, which we colored with a light blue. There we have it. I have a clinical note here. The musculotendinous rotator cuff strengthens the shoulder joint on its superior, posterior, and anterior aspects. Hence, about 95% of shoulder dislocations occur in an antero-inferior direction. Repetitive abduction, extension, lateral or external rotation, and flexion of the arm at the shoulder, the motion used in throwing a ball, place stress on the elements of the rotator cuff, especially the tendon of the supraspinatus muscle as it rubs on the acromion and coracoacromial ligament. Tears or ruptures of this tendon are relatively common athletic injuries. Thank you so much for joining me today, and I look forward to coloring in